Toma Health is looking for feedback from its patients as part of a new survey program. On this edition of Health Check 360, Toma Health Quality Compliance Director Shelley Eggstead joins us to talk about a new patient survey known as Real-Time Feedback. Welcome, Shelley.
Thank you.
Sounds like an exciting feedback type of program, and you're getting feedback in real time. Can you talk about who are you in, or like what patients does this apply to, and then how are they giving you the feedback?
Sure. It is for our specialty clinic patients, ortho, general surgery patients, our Warren's Clinic patients, our urgent care patients, and then our outpatient surgery patients. So it's quite a number of patients that are getting the real-time feedback. They actually get a text after their visit within 24 hours, or a phone call, an automated phone call, or an email. And the emails will come at any time, but the texts and phone calls will come usually between 6 and 8 p.m. They've done studies to show that's when you get the most feedback from.
Really?
Yes.
That evening time is
is the best time. So within 24 hours of their visit, they have the opportunity to respond either by text or answering the automated phone or email. And then within 24 hours, we get that information. And so we are able to respond to it, react to it, coach, counsel, improve based on that information very rapidly.
So that's the real time.
Yep.
How are you getting feedback before the real time?
Before the real time, a survey would go out by mail, probably a week after the visit. And sometimes people are busy, patients, don't necessarily have time to fill it out. They would send it back maybe a week, 2 weeks, sometimes 3 weeks, sometimes a month later, and we wouldn't get that back then for maybe 6 weeks. And it's so much more important, it's so much more valuable to us when we can get it within a week of the patient's visit so that we can respond to it quickly. We know who was working that day. We know if there were delays and what we can do to improve the delays on that day. So it's a very, very beneficial thing.
When did the real time start then for Toma Health?
Actually, it started in August, so we're just getting into it. I'm really excited because our response rate has been super. Previously, about 8% of our urgent care patients gave us feedback, and we're up to 24%, which is
You've doubled, tripled your
the
feedback.
response. So overwhelmingly, it's been positive. It is wonderful for our staff to hear that they're giving great care. It's also very valuable for us to hear what we can improve upon. If we don't know about it, we can't improve it. So it's been a really beneficial thing. Staff are loving it. They have been very busy with COVID and all the things that we do at the hospital, and so hearing those positive comments has been like a shot in the arm, and just spurs them on to do even better work. So.
And Shelley, what about the patients that aren't in some of those specialty, like the urgent care? How would they give feedback if they're not a part of those specialties like the Warren Clinic and urgent care?
Sure. Our emergency room patients and inpatients will receive the paper survey. The federal government actually requires that we send a paper survey. We can do it by phone call, real person phone call. So that I'm hoping will change in time, that they do allow us to do this rapid feedback. But right now we're still doing mail for emergency room and inpatients. I'm hoping the next phase will be getting our ER patients in this program. So we'll hoping that'll be probably 6 months to a year from now.
And what are the dividends from this real-time feedback?
Like I said, the staff loves to hear what they did well. They also appreciate where we can improve. They know that we want to be here, and patient experience is a priority for the hospital. It's part of the strategic plan. We want to be in the 90th percentile, meaning we're better than 90% of the hospitals. We're in the 86th percentile right now.
We're close.
We're close.
Well, yes.
We're going to get there. So they appreciate hearing it. Managers post the comments, so they see what patients are saying about us, and they have the attitude to, we can make this better. We can do better. If there's a wait, what can we do differently? What can we improve next time? What more information can we give the patient to make the next patient's experience be better? So.
Good luck. Excellent job with that, Shelley.
Yeah, thank you.
So thank you for joining us.
Yes.